Anyway, what you want to know about light, I will not be able to tell you all this in 1 hour, but we'll start with the basic things, okay? And then, of course, like, let's say, you can read a lot of things too, but I will try, and that's what Mary is for also, that she can guide me to help me to tell about the things that are most important here. All right, because some things you just need to read. Like if you have the book of Jacob Lieberman, you know, it's the oldest one that actually started the whole story, like also 30 and more years ago. And of course that's fantastic, but that's a basic, all right? But we, all over the years, of course, we changed, we adapted, and, you know, got many alterations to have it for a modern praxis. Because the older ones, of course, they are working like about, you needed to have like 4 or 5 times a week, at least 20 minutes of session. And of course, people don't, nowadays, they don't want to do that anymore. It's too long, you know, but over time, I will tell you later. So we are working with the photon wave light therapy, and I will tell you more about where it comes from, like here. How does, is it big enough? Can you read it? Okay? Okay. So you give... We are working with the light through the eyes, which is, of course, the quickest and easiest way to reach the brain. Don't you have it bigger? That's good. Yes. Thank you, Mary. Don't fall over all the cables. So via the eyes, the way of the eyes, and we are looking for they call it the retino-hypothalamic tract. That's the way from the eyes to the hypothalamus. We are trying to, let's say, support and activate the autonomic nervous system, the sympathetic nervous system, and the parasympathetic nervous system, and then the endocrine system. And of course, that's a lot, what we can do. The next, this is kind of, because people sometimes they think, you know, light and color, this is also esoteric. You know, we sell a lot to doctors, and so they almost don't believe it sometimes. But then when you see this, you see that little small part here, that's the visible spectrum. That means we are only working with the part of the spectrum that you see. You know, they work with, how do you call it, ultraviolet, for, let's say, for purifying the water. That is what they simply already do. They understand that radio waves, cell phones, this is something not tangible. You just can't see it, and they believe in that. You know, but the little thing that we work with the visible light, you know, this is actually very important for us. Because it's that you feel. I mean, like you're working with biofeedback or something, you don't really feel it directly on you. But with the light and the color, you have a feeling what it does for you. And that is very important, also for healing, for a lot of things. But now, a light stimulation via the retina and the optic nerve. That's, everybody knows. You have to have light to see. Okay, so you see here the light paths 1A and 1B. That is from the visual cortex to the cerebral cortex, right? But then you have another light path, which we don't realize sometimes. It's the light stimulation via the retina and the optic nerve to the hypothalamus, the pituitary, pineal, limbic system, brainstem, you know. And those are actually the president of our whole system. You just, you know, they organize everything for us. And if you look further, of course, I'm not going into in details and on the whole thing, but you will see, you know, this is, everything is together. You can't separate it. You just can't say, well, I want to work on my sleep pattern or on my heart problem or something. No, you can't. It's hanging all together. And of course, I have a very nice dia or the slides on all this. I will just, you can read it a little bit if you want, otherwise it will take us too long, because this is kind of, or you know it already, but you can read it, please. The brainstem, of course, is very important. And then the cerebral cortex. This is like for children and learning, and you know, this is absolutely motivating for them. Limbic system, the emotional behavior, and of course the limbic system, that means also like you have the passiveness, aggression, happiness, sadness, all kinds of emotions, which also the ones that we have from former, you know, traumatic, let's say, experiences when we were a child or something. You know, those, it's very important that we address those psychological issues too. And we can easily do that with the light, right? And then, in short, the hypothalamus, he is the president of the whole brain, all right? So, autonomic nervous system, hormonal control, anything, you know. But then you also have the pineal, pituitary, we told already. But this is all like, you know, but now we are reaching, and this is actually the wonder or the miracle about, what is this? It's the optic nerve transmits the electrical stimulation of the light to the brain. And that is what we need, the electrical stimulation. And you would say, you know, in the northern countries, everybody knows it's kind of that you don't have enough sun or you don't have enough darkness. For me, it was very strange. This morning at 4 or 5 o'clock, it's light. Oh, it's disturbing to me. And then the other way, in the winter, of course, you have not enough light. That everybody would understand. But then that means also nobody in the south would be ill. You know, in the sunny countries, they are as ill as here. Why? First of all, because they had also maybe traumatic brain injuries, whatever. I will read it further here. Because I'll show you. Here, that little path is the optic nerve, you say in English. Okay? But if that is, the conjection of the optic nerve is the result of intraocular pressure. The pressure that comes from the cerebrospinal fluid that bathes the nerves. So if this is compressed, you can do what you want. You can take medication, you can do yoga, everything you want, it will not help. Because you don't have enough access to the brain, to stimulate the brain, okay? And this pressure actually increases under emotional and physical stress. Most of us, we have fallen from, you know, from somewhere, a child from the table, from their pushchair, or, you know. But you say, well, he's not unconscious, it's over, all right? It's not over, because months later, or years even, let's say normally it's months later, their behavior changes. And you don't know why, you know? That's one thing. Then the other one is also like neurotoxicity. We are the group that is working with Dr. Klinghardt. Actually, I learned a lot from him. And I almost couldn't believe it. But he is always talking about heavy metals, and I find it's kind of threatening, you know. So I say, oh my God, this is so, you know. But that is the main thing. That yesterday, the gentleman, that the doctor here that was working with the old people, they all have kind of intoxication with heavy metals, and that is what their brain fog is all about, you know. And children, let's say Dr. Klinghardt here is a specialist for autism and borreliose, how do you say it in English? Lyme disease. And he says that even small children who has been diagnosed with autism, they have like a brain fog, and it's about the vaccinations. Now, we have a solution to, let's say, get rid of them in a very easy, clear way without, you know, not too much difficulties, and so that's fantastic. So I will come to that later. It's only to say, if you don't have enough intake of light, it's impossible to cure. It will take you 10 times longer, all right? So next one. here. But how do we know how much light is coming to the brain? So we can measure it by the input of light by way of a visual field testing. And we do it with the computerized visual field tester. It's called the F-field color field tester. Actually, it is not new. It's from the years 1930 or something. It was an American, Brombach is his name actually, and he found out that when the visual field was very small, people didn't function well. And he also made the correlation with the teeth, you know, infected teeth and the visual field. I think it's very interesting. That's what Klinghardt is now saying too. So we made a PowerPoint on that, if you are interested in that. And I suggest that everybody is working with children, you know, at least have a field tester, because you will see afterwards why. Because those children are not ill. They have no real problem, and then they are just they're naughty, they are lazy, they are, you know, whatever. No, it's not that. They only see this. But if you have to look for your shoes and your bag, and you know, and you have to go all the time like this, it is terrible. And you just knock out and you say, I don't care anymore. So they are looking to the window, and that ADD, or they get so nervous and aggressive, you know. They say, oh, and that is what we experienced after, like, let's say, from 5 to 10 light sessions. They are new, totally new children. Their parents don't even recognize them. And so that's why I promote the field tester as a help for the children. I think for people that have kind of complaints that are not clear, it's very well too. But most of the patients, they know I have this, I have that, I have pain, you know, and they can, well, they know if the pain is over or not, okay? Now, how does it look like? This looks, you have a screen. You can do it on your laptop also, but then you need to have it a little bit standing higher. I'll show you how it works here. So this is like a little girl, 11 years old, learning disability, aggressive, depressive, results after 7 light sessions. Look, you see the difference? It's only one eye, you know, before and after the sessions, okay? So what we say is about the FCF tester is used worldwide as a test for evaluating how much light input is reaching the brain and the visual cortex. It is an objective test, you know, and that is also very, very good, because when people are still doing them in America, you know, by hand, but it's not correct. I had them, you know, I introduced them actually in Europe, and it was like, you know, you said, don't you see it yet? I would wait, you know, because I thought this is impossible, so small. I felt pity for the children that didn't see it. But with the computer, you know, it goes on and on and on, on and on and on, and you know, you can't cheat. You know, it's kind of, well, this is it. For instance, like with this girl, I remember, because she was one of the first one I did a study with, and I was so lucky that I did first with her mother to show her, you know, and the mother was relatively normal, and afterwards I did with the girl, and then the mother, you know, she broke almost in tears. She said, my God, and I have, you know, punished her, you know, made with her everything. I was always so angry. Every day we have, you know, let's say, hard times, and she doesn't see it. So, but afterwards, of course, when it was big, you know, it's like 10 years ago now, and I can follow them because they live in my little village. They are so grateful. Now she's a student at the university. She's already finished. But before, they had, you know, they said, I don't know what she's going to do. She can't do anything, nothing, you know. And they have a big company, the parents, so, you know, they were very frustrated also. Anyway, so you see the difference? This is one of the extremes, of course. Huh? But the nice, it should be nice and round. That is and then, you know, they are done. This one is a little boy. 8 years old, learning disability, shy, ADD, and this results after 9 light sessions, which is totally different. He is now like a football player, you know, one of the best around. And before he looked at me like this, you know. It's kind of, there are different children. And then this one, another one, you know, you see the difference after eight light sessions. And I mean, this is not difficult. The light sessions, they take only for 8 to maximum 12 minutes. You know, every child, every person can do that, because you have even 3 different colors follow one another, right? And then is somebody here, he has a glaucoma patient, and this was the result after 6 light sessions. And I don't know whether you know what glaucoma is, but it is a threatening disease. You have to take lifelong drops, which is not a good perspective neither. And you know, they are very happy with all this. Of course, those fields, they have, how do you call it, a meaning, but I'm not going deeper in this, because not everybody will want a field test, and then we can do that afterwards. Okay, and how and what do you think can be helped, or what is an indicator that you have photocurrent deficit? You know, like epilepsy. We can cure epilepsy with light. But there's one thing, everybody asks me, do you think, because epilepsy is one of with the flickering light, it's no problem, you can cure it, but you must put the flickering higher. We put it on 35 hertz, and then it doesn't flicker anymore. And then with the indigo color, it suits the brain. It's kind of, you know, you're like a new person. And once you get known for such a, you know, such a treatment, like we had a doctor in Germany, the people came from overall to him, because it's kind of not curable otherwise, you know. So it's possible. And then when you have menstrual problems, light sensitivity, allergies is, for us, is a pleasure. It takes one time, second time maybe, and then it's over. Can you imagine? All the people sneezing, and with the pollen season and everything, it's you know, you should do it. My, how shall I say, frustration is sometimes that the doctors that work with it, they use it or for, you know, detox from heavy metals, or only for emotions, you know. And I say, you have it, I don't sell you anything. Please help the people with allergies. This is fantastic. And it costs only like one session. They come back, you know, we test. I don't know, who was here testing with kinesiology? You know, or nobody? You, yeah? Okay, so that's the easiest way. Then you are sure it's over, or we have to repeat it. If you don't test, you know, just do it 3 times. One after another, not on the same day. Huh? I mean, like you do it on Monday, on Wednesday, on Friday, something like that. And then you cover it, you know, yeah. Then neurodermitis, this is the same thing, but they have to follow diet. ADHD, ADD, fantastic. Well, you have seen the slides before. Huh? Dyslexia, same thing. Whiplash, okay. Then we have another one here. This kind of toxicity of heavy metals. There's only, you know, one. I think it's the easiest, quickest way you can get rid of heavy metals. I have proof on that with urine probes, and you can look at it afterwards if you want. Okay. Chronic fatigue syndrome, well, this is not, there's not a program chronic fatigue. You have to do, like, first of all, you do the detox, then you do the candida, and like this. There is a continuation, what? A protocol, yeah, on how to do that, you know, but it doesn't take months and years. You just get rid of it in 2-3 months, you know. Isn't that fantastic? So candida, impotence, well, there are many more, but of course, because we are not a doctor, we sell to doctors, and we only, let's say, we only sell to therapists. That's another thing. And they would follow up, you know, it's easy. And then like depression and stress, is no problem at all. And I don't know whether you are familiar with dark field microscopy. Okay, this is session before. Like it is a patient under influence from Wi-Fi. How do you say Wi-Fi? And 24 hours every day. And it looks very bad. And that is after one session of detox. It's a very big difference. You know, it's amazing. It won't last unless he changes his, and that is where Raphael spoke about this morning, I think. You know, you have to change your environment, otherwise you're all the time under influence. It kills you, you know. Anyway, you have another one. This one, it's not that bad. But then, wait a minute. So, before and after. It's a big difference. Okay, then we have one here with Kirlian photography, before and after one light session. People that are familiar with this, they will say, well, it's not bad, you know. So there are two ways of working with it, because I've done it so long time already. You may take photographs, but you get everything, my whole PowerPoint, if you want, on a stick or on your computer. So you can just reread it, print it out. That's a part of, you know, what we give. Otherwise, it's impossible to remember everything, right? So how do we proceed? We first always do the detox program. Even when the children are coming, you know, with ADD, ADHD, whatever complaint, we do the detox program. Okay, that I'll explain later how we do that when we have a machine there. And I hope I'm doing right. Are you okay? I mean, like she said, don't tell too much about this, but you know, go just in how to do it. People, you know, you don't want to hear every single detail for starting. But then what we also do is like for miasma, but I don't think in this group will be appropriate. We are testing for a lot of things, you know. And that's kind of nice. So once a week, a person would come. And if they live too far, we can install the water, you know, the color we put in water, and we give it with them. So it's the same time. And I'm happy that I heard yesterday Rasmus talk about the water, because one can't almost believe it, that you can install water that is kind of giving the information. Anyway, that's how it works, and it works. So the detox program is the basic thing, but now how do we do it? And then what we always suggest is you have to drink a glass of water and go to the bathroom as soon as possible, because the toxins are released immediately, right? And that is how we do it. Can you just take the plexi plate out and show them the plexi plate, please? Okay, and here you see it. Let me see. This is the little hole, you know, for the toxins like herbicides, heavy metals, vaccinations, which is a big problem in Europe. I don't know where, everywhere, but here it's terrible, and even in America. Mm-hmm. We do the detox program for the inversion of the information of heavy metals. Vaccines, glyphosate, it's a terrible problem for the moment. Toxins, pesticides, okay. The test vials you put aside. You never put, you know, any vials or any whatever in the middle against the color, because that would ruin your vials, and it's not necessary. So, and then we have another procedure. So, after completing the detox, we continue with specific programs. We have a program for parasites, we have a program for allergies, we have candida fungi, program 3, you know, all tested materials against the plain plate. Now, don't get, let's say, afraid that you don't test, because there's a way to surround that. I mean, like, if you take let's say you would take stool or urine or hair. You know, we take hair from the gall meridian. You can take nails, everything that belongs to the person himself, what he, you know, you can cut. And that is the way you put it in a little glass jar, you know, like a glass marmalade jar or something. You can put against the plate. And then you have the quickest and the best. You don't even have to test, you know, and we call it personal sample, because it's your personal sample, right? So this is the easiest way. And people bring it every week, another, you know, your hair or whatever. And maybe it's strange, but that is, it's also something, it's known. It's not new. I'm not telling you something new, but you can do that with the light, right? And that is the personal sample. I have a whole bunch of questions and answers, and if you would look at it, you know, sometimes people, where did I put again? How shall I do? And I say, look at, you know, paragraph F, personal sample. You know, water, how to install water, you know. It's all well, let's say, documented. You can find it. You only have to print it out, right? But that is then, here we have whole aside, because we have two modalities. And that is to send the information of viruses, bacteria, allergen, or other substances via the light way and the eyes to the brain. So this is a signal enhancer. The signal that's coming from, you know, everything is actually has a, you know, it's information that you are getting right to the brain. Mm-hmm. And then you don't need the hole, because the hole is for inversion. For this one, you have to the straight, the plane before the. This would be the light, right? And the hole is aside, right? Is that clear? I hope so. That's clear? Not yet. Doesn't matter. It'll come. So what else do we have to say here? So that also, we can also put like supplements. You know, there are so many sick people that even can't, they need to take supplements, but their body can't take it anymore. Their stomach, they can't eat anymore. You know, they have to take sometimes so many things, they get sick of the medication. So you can also add it with the light, you know, like you just do it this way. But then you put another program. You put the program with green, 10 hertz and 8 minutes. It may be longer, because green is the middle. You have the red side, you have the green, turquoise in the middle, and then you have the blue side. But with the green side is the healing side, you know, and the color, I mean. So in the middle is green, and then you can just install everything. I don't know whether some of you, of course, know, some of you know Dr. Klingert, but in Vienna at the in the ILA, it was in Vienna 2 years ago, and Dr. Klingert spoke there, and I can only tell you, I thought, my God, what is he saying now? He said just openly to everybody, you know, with one drop of, you know, one pill, I can cure like 1,000 people. I said, oh God. This is kind of something dangerous to say in an audience that you don't know. But I have not been killed in the meantime. Anyway, so you use it as much as you can. It will take, you know, your patients will be okay, quicker, better, easier, you know. And, well, I think we are in a closed group here, but you will get the money and not the pharmaceuticals. You know, you won't have side effects neither. Mm-hmm. This is the truth. And then immune modulation, Klinghardt says what it is, you know, it's a response in Lyme, because he is well known for Lyme, you know, it's a long time already. Huh? And he says it is an over or an under-reactive response, okay? Iron and copper in Lyme is low. But then you will have, later on we will see like a kind of a star where materials like are heated and they have a predominant color, and that's very interesting. Like for instance, iron is yellow-green and copper is orange as color. So if you take, for instance, I had like a mother with Lyme, she came, that nothing, but she said, my little son, at night he has really screaming out of pain in his legs. And we need to give him shots of magnesium. Magnesium, huh? Okay. And then I said, come, let's try, just give him the magnesium, the yellow. And it was over in one time. Can you imagine the difference? Even for a small child, not to be injected. I love it. Enfin, so also children with autism, Klinger says, mother had non-diagnosed Lyme. You can check that, but that is only with muscle testing. And with the children that have autism and so, or autism, you must always look for parasites, allergies, because they all have. Even if you would think, why I don't think so. Well, check it, or just give the program just for parasites. At least they are rid of it, right? Like for instance, in some countries they do every year a parasite cleansing, but like in Belgium we never do it anymore. I don't know. It's kind of. Well, anyway, so more about the mercury intoxication. Amalgam fillings need to be removed, but out of my experience, I see people getting worse afterwards. So I say, be careful, because your dentist doesn't feel what you feel. If you are very ill, just go slowly. Even if you have a kind of, we call it a biological dentist, be careful. They don't realize how much impact the narcotics have on your injections, have on your system. And that means that you are going to get low immune system even more. So I suggest, if you have amalgams, make first that you are feeling better, and then you do 1 quadrant per time, and you leave 2-3 months in between. And this is a serious, advice that I give you out of experience with patients and with clients. Okay, so that's one. And for instance, now mercury goes to the brain, and that is why zinc, food, fish, and testosterone provokes more autism and Alzheimer, more in boys and in men than in women and female children, girls. So, that is one of the things you need to be careful. Mercury goes into the brain. Glyphosate and mercury block the pineal. And what they do now also is give to melatonin to detox from mercury, for cancer patients and for sleep problems. Well, if you have light, or you can get some water-induced turquoise, use turquoise on the Photon Wave, use that instead. You won't get addicted to it and you will have the benefits. That's something sure. Still okay? Can I continue? Okay. There is another, we work with light. It could be white light in general before, It could be, we have colors, but we also have the flashing. And the flashing ray is to entrain the brain. I was 7 years on the road with Dr. Steven Vasquez. He was invited in Germany all the time, and at least twice a year. And I learned a lot from him on the psychological level, and how to combine, where to go and where to find the emotions, to help the people. And this is something I can't do in a session like this. We really have to sit down, and then you talk with the person whilst you're sitting there and you're giving different colors. This is also like a it's not a fixed program. I can't have a fixed program for that one. And we can, anyway, so like the ruby and the red, they are more on the active side. Active attention gives access to conscious trauma, right? Okay, that's, we understand that. Alpha is from 8 to 13. It's more already introverted, conscious, healing state, in comparison with the theta, which is from 8 to 4, right? Flickering. And you would see, I will show you later, that it's kind of, it has much more impact on you when it's slower. And on the pre-programmed sessions, we never go below 8, 7 sometimes, very little, because it's too strong. And if you are a psychiatrist or a psychologist and you want to access, there's something deeper going on, and most of the time, chronic patients, there is something more. You go, but then you know how to get the person to normal again. We don't want them to get in a shock, and so you will see all the pre-programmed programs are on a certain. They are from 13 to 7 maximum, all right? And because this is an hypnotic state and gives access to unconscious trauma. Let me tell you something. Like we had once, it was in London somewhere, not with Klinghardt actually, and we had some violet on 4 or something, pretty low. And in the night, she screamed and she got totally out of her self-control. She suddenly remembered that her mother was killed in the room next to her, but nobody has told her that. But this is dramatic. But they tell, yes, your mother died, when you were a child and all that. But nobody tells the truth to a child, something like that. But she had heard it. She could not place it because you're a child, Anyway, I mean, like it's really difficult. I would never go under 4 unless I know, I'm sure what is going to happen, and I'll tell you already a little detail about that. Whilst the person is looking and start to cry, oh my God, like that, then you just go higher with the frequency. When it's turning, you can go higher. And you say, keep on breathing, eye movements from up, down, like that, and go up, and then you go up to 20, and then they are coming in reality, in the real life, and they are no more in that situation. And this is something, I can do that when I'm there, but I mean, like, I really do not wish everybody uses that. That's why I'm telling, right? Okay. Now, what is so specific about the photon wave? Well, we have the narrow band filters. Some people say it's not important. Other people say it's too strong. I don't know what it is, but I only can tell you the difference between what we had the old machines. I've been importing 14 years the Lumatron, and then afterwards the Photron, which was a smaller one as the Lumatron, and it had from 40 till 80 nanometers. So that's why we had to have such a long sessions, and then some of one and his brother of the Syntonics himself, the guy was an engineer, his brother, and he said, if we try with other filters, that would be much easier to take for the person and strong, on a shorter term, and that's how we came to that, kind of new filters and so on. So I told already, therapy time is definitely shorter. And what we have now also is like, we have 2 wheels, so you can combine. We had about 40 colors. And that means if you say, well, I want like a blue would be okay, but maybe I will soften it with a little bit turquoise, or I will soften it with indigo, you have the option. Before we only had like 12 colors. 2 of them were color combinations, but then we thought, why not take more combinations? It's more effective. And that's why now we have, before we never had magenta, we never had sweet pink, those colors you didn't have. And for instance, they serve as fantastic, like for depression. Depression, mild. That means like it's yellow, orange, orange, blue, you know, all the softer color, but going deep inside you. And in one time, you know, a person says, well, you know, they are back in control. They are not feeling so depressed anymore. You know, they might come back. Of course, they must come back another time. But it's kind of, it's unbelievable. And that's what we like about the two wheels. The only thing is when you change the wheels or something, you have to be careful that you don't say like on a computer, boom, 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 like that. No, it doesn't work that way. You have to listen. The wheel is turning. It needs the time to turn. And I'm telling you this because I had one from America, and the person said, oh, I did something wrong, and then they have to send it back. You know, better that you are aware of it here. And you just push on, you know, one, you hear it turn, the other one, turn, okay, and then it's fine, okay? But because it's mechanical, it's not something, it's not with LED. Sometimes with LED you can just flow like that, you go from one color to another. But we use halogen bulbs because we esteem, as far as I know, that it's closest to the natural light. Okay? And LED is a mixture. There are three basic lights and there's a mixture. And what we ever, you know, we always heard that we need the glass filters and we need not the plastic filters and we need the best of light. So, you know, we try to use and continue this way, right? So, it has also a CE certificate. It is not a medical device, because then it would cost much more, because actually it wouldn't cost that much more, but we need another kind of certificate, and just getting that costs a lot of money. And Klingard always said, let's keep low, you know, otherwise, you know, you have to go, let's say people want studies. Studies, that means for one thing, like headaches, migraine, one color, at least 20 people, okay? But we have so many things. How are we going to prove all that? And when I started, we were really out for, I want research, you know, research is what we need. Who can afford it? Nobody can afford it. Unless, of course, you have, like, you say yellow and this, it's kind of, it's a different approach. And if you keep low profile, you know, in Europe it's no problem, but I mean, like, for America it would be more a problem. And so I don't know how it would be in Japan, but anyway, we keep, what we are doing is for the sick people, for the therapist, the easiest thing, and what will follow, I don't know. So, and now we have, so like before, Randy Marie has still another machine, an older one. She has one that is, we started with the new kind of filters in the year 2000. And Randy Marie has one from 2001. So that's an old one. But there you have to move it by hand, the filters, you know. And then you have 3 minutes this color, 4 minutes this color. And you know, therapists used to tell me, oh, come on, Leona, this is boring. You know, I can't do anything in 3 minutes and then just come back. So the patient is waiting. Another 4 minutes, patient is waiting. And then I thought, you know, we have to make it automatic. And then now it has the possibility with the programs. And then we started off with 20, you know, the most common problems, all right? 20, and then they say, why can't we have more? Okay, you know, just give me what you want. And then that's how we build it up now until there are actually 99 possibilities. 90 are pre-programmed, and the 98, and wait, I'm going too quick. I can follow it here maybe. So the 2 until the 90 are preset programs. But then the 91 and the 97, you can choose yourself. If you say, well, I need something for, let's say, a girl who has epilepsy, you can install your program yourself, just the same colors, but you put it on the 35 Hertz. Okay, that is actually therefore. And then the program 98, it's each basic color 1 minute. And that is fantastic, because like people, we do also like a questionnaire. If you don't test a questionnaire for the colors. It's wonderful. I just had a lady, she is asking me, what shall I give to my patient? You know, she has one blind eye and the other one is kind of, you know, very sick already. And I said, make the test. Then you go from, the test is from, you go 1 minute this color, 1 minute that color, like that. And then you note how many, how do you like it? You know, 9 is very good, 10 is the best. And then you go 2 or 5, that's not too good. And then you look at the end, all the colors, you know, which the one they like the most. Well, you give them another 4 minutes of that color. It's the healing color for them, you know. When I was 30 years ago in Aspen with Jacob Lieberman, I thought, you know, when I got his book, I thought, I have to go there. This is the only one that will understand me, because nobody in Belgium knew about all these things. And in that time in America, it was like everybody used that, oh, and they should cry and, you know, with cushions and throw to each other and like that. And I thought, no, this is impossible. People have suffered enough already here. And Phyllis, you know, this Phyllis, the lady that my time the same, she organized the things here in Norway, the seminars and the conference. And Phyllis too, she said, I can't do that to my patients. This is too hard. You know, maybe it's the American way, and we did it the softer way, and it works fantastic. But if you do we call it, you know, the questions for, I don't know it in English now, it doesn't matter. So we have a questionnaire where you fill in, then you sit there in program 98, and the person is, you know, sitting, and you say, okay, which color do you see? Because sometimes they don't even see the right color, you know. And they say ruby, okay, and how do you like it? How many points would you give? And that's how you go. And then, like for instance, the lady that asked me, I didn't even respond yet, yesterday, green was fantastic. And like the ruby, the red side was, bah, I hated it. It's something. And then, you know, what shall we do? We give her green and turquoise. That was the color that she gave the most points. Okay? So you never are wrong, you know, because they are feeling it, they are seeing it. It's not you know, something in the air. And that's good. That's one way of testing, that's the best. And then you have the program 99, which is each color 2 minutes. It takes a little longer, but it's worth it. Because sometimes people are very, you know, slow in reaction, and they say, oh, well, now I see, maybe it looks like green. No, you know, just kind of out there. They are not with their feelings. But then, when they have the time, okay, they can come to it. You know, it's 2 options. What in my practice, actually, many people came. Well, not many, but I mean, like, a lot. They came afterwards when they are, you know, they are done. It's fantastic, they are feeling good, you know, thyroid is okay, whatever is okay. And then they come like every 3 or 4 weeks for, they call it their color vacation. And that means they take the program 98. Just each color, you know, each organ, each emotion is, you know, supported. So that's what I like. Okay. And so, well, you don't see it very well. It's how, I'll show you later. Of course, the darkening hood, there we have a black cloth, how would you call it? It's a cloth that you put over your head because of, not everybody has a dark little space, so you can use it everywhere. We started to have it actually because in a conference you just can't sit aside in a little dark place. But with this little thing you can use it. And then it folds smaller because you need a certain distance from the eyes, for the eyes, otherwise you are crossing the eyes when it's too close, you know. And this is the right distance. Now, presume you have somebody who says, oh, I can't support the light, you know, I've never been out. I have one in Australia like that. And we speak on Skype. And she said, I don't come out for days and I can't support the daylight anymore. I said then she can't even see at the light, look at the light. So I said, hold it a bit, step back, don't put it that dark, and then she can have it. And at least she's progressing to a better, situation where she can have okay. Then here, for the people that would test, you can have those color-induced test bottles. They are from Vienna. They cost 60 or 70 euros. It's not expensive, and then the people test like this color, that color, or this one, and the hertz also. Right? It's helpful. If you don't test, don't buy them. And this is a nice chart, which is also on of course on here. And then you can, when you print this out, sometimes with teenagers, you just go and you show them and you say, what do you prefer? What color would you like now? Because they are very, why should I do that? Mm-hmm. If they have, they can choose, they will take it. Otherwise they will just say, I don't want color, I hate color, just like teenagers are. But when they are in control, and most of the time they are taking or choosing a color that is good for them. So you can trust them. Children you can trust. We are more like, I think green is good for me, or I always wear red or something, why? Mm-hmm. Children, you can trust it. So, what are the frequently asked questions? How long does a session take? About from 8, maximum 15 minutes. Only the program 98, it takes 20 minutes. The client looks at 2 or 3 color combinations once or twice a week for approximately, let's say, 12 times. People ask me, how do you every time, they pay? No, I would suggest, they will come more than 5 times. Take 5 times, pay for 5 times, and then they know it's already working, it's fine. Do you need more sessions? Well, then you take another 5. That's how we did it, okay? Just to make it for you simple. And sometimes when they say after the first time, oh, no, it's not my thing, which actually never happened to me, but it could happen. I heard somebody that, so that's all. And how many sessions does one need to feel a difference? It is common that after even 1 session they feel a difference. It could be 2 or 3. And if after 3 sessions they don't feel a difference, you must look for something different. You go to the program Emotions, because there are 4 or 5 programs specific for emotions. And you let them choose. Look, what do you think of these programs will be appropriate for you now? And then they understand that, And then it turns, because also they feel in control. And they can release the emotion. They cry or they don't cry, just keep handkerchief always all the time there. And then let them cry, it's good. Like for instance, I had a woman who had glaucoma. She was only 47 years old. And her husband was a psychologist. And I said, come, let's test, let's talk. And then we tested. And suddenly she started to cry. She said, I always wanted a child and I couldn't have one, And then she didn't want to see. And then afterwards she had also kind of heavy metals. So she took several sessions for heavy metals. And then the glaucoma. And it went from 24 to 18 without drops anymore. 47 years old, It's a difference, don't you think so? I like it. I can't say no. So, but if ever it would happen that after 3 times they don't see the difference, they don't feel a difference, go to something different. Just do it. Do we have to expect negative side effects? It is unlikely, as is known in homeopathy, that we see negative side effects. It could be though. Recently I had a practitioner, and he himself and 2 other of his patients had tremendous, they felt sick and tired and like that. And I said, what did you do? He said, well, I took the detox and I took program 12 for headaches. But it's too much, too much. Because you have the yellow-green, there's only one dangerous color, let's say. It's the yellow-green. Because with the yellow-green, you detox. And if you are going to put on your liver twice the detox, you know, it's kind of, you scrub your face and you do it another time and more. No, you will hurt yourself. And that is something you better wait and then, you know, like that. This is the only explanation. It's your liver is getting out of the, you know, they want to get rid of the toxins, and you do that with the second and the third color, but you don't repeat it. If you do repeat it eventually, and you don't not getting sick, it's okay. But if you are, that's the only reason. That's I can think. Oh, what else? Of course, if you are doing any other kind of therapy, you must combine it. Sometimes it's not easy to find the right way to combine it, you see. They say, shall I do it before? Shall I do it afterwards? You know, when do I give light? And then, like for instance, we have osteopath. They use 4 minutes indigo before the treatment, or 2 keys, and then the person is relaxed and they can work on them, you know. Otherwise they are pain. I'm going to sit there with pain. When you are so cramped, you can't relax, and it's very difficult for the practitioner to work on you. So if you give them 4 minutes of the, you know, relaxing color, it's much easier to work. And then afterwards you choose, you know, which part of your back is it. You know, if it's a lower back pain, you can show maybe it's sexual problems, bladder. It's sometimes an operation, you know, you go, there's a list on that, use that one. Okay, I think we are almost done here. Yeah. Who is offering light therapy, medical doctors, ophthalmologists, behavioral optometrists, naturopaths, psychologists, osteopaths. Well, which we don't have a lot of is chiropractors in Belgium. There are very few chiropractors, but in America more chiropractors than osteopaths. Okay, but here in Norway, like you, teachers that are working with children, and of course they are best placed because they are dealing with that child every day. They know that child, and sometimes they know the parents, and that's okay. But I would never, you know, well, I think that's the best way. But and then is Klinghardt here, with he worked with, as we did since the year 1986. He has collaborated with us for the Photon Wave for 17 years. Yes, the Photon Wave, the plexi plates inside, that's his idea, and we did not have that before. So that it's a miracle. If we would not have the plexi plate inside, it's a normal, like any everyday kind of light that's shining on you. But with this, you can reverse things, you can get out of things, and you can get in things. And
could you just explain what those plexi plates are? Could you just explain what those plexi plates are?
Lady, no, the gentleman was too late here. Can you just show it again? What is the plexi plate? Yeah, you were coming in a little bit later, weren't you?
Yeah, but it was not very easy to understand.
Shall I go back to the
Okay.
It looks like this,
okay.
and it's a signal enhancer.
No, it's not.
So
it's not plexi. It's
a signal enhancer. So it enhances the frequency in whatever
But what
you
is
do.
the material?
I'm actually not what it's I guess it's plexiglass.
Okay.
But I know it's made very carefully.
Mm-hmm.
So it's not just something you buy out of a tool shop. So it's layered in many ways to enhance the signal. So it's kind of, yeah.
It's not simple. It's not simple plexi. I call it plexi because it looks like plexi, but they call it a signal enhancer. And if you want, I have it somewhere on my computer. What is the exact thing? So, and then we have those were the syntonic pioneers. If there's somebody here who is syntonic or is working with eyes, and I don't think only you, Uta, and you are also working with eye training and so. well, you would know these. Okay. And of course, I always have to say, and it is on every paper that you would also, that it is not a medical advice, and that's why, we should also advise our clients or our patients to, get medical consult. That you are not. That's why I don't sell to lay people neither. Okay. So, and that is our last slide here. Thank you for your time and attention. One thing is for sure, life will never be the same. It's light brings life, and you will feel the difference for yourself and your family and your friends and your patients. And I wish you all the best. Thank you.
Is there any questions? If I want to buy a Photon Wave, how much does it cost?
4,800 €. It's not much. For what it is, no.
And how much do you take for one session?
It depends. If you are already like a doctor who is asking 500 € per session, well, there are. Yeah, but if you are asking like 100 €, you can easily add 50. It's, and then people come, not every time, they come only for like a light session. You don't have to do every intake anymore. Then you charge like about 45.
You can charge whatever you are charging in your own business, like a half-hourly rate or 1 hour rate. Any other questions?
Okay. I invite you, please come up and we will put the machine upstairs and Mari brought her too. You can try and see how it looks and how you feel and look into the papers, alright? Thank you very much.